Good morning, everyone. Thank you so much for joining. We will just give a few more minutes for some more folks to join, and then we will go ahead and get started. Okay, so we will have some more folks be joining us, but we will go ahead and begin the webinar. So good morning, good afternoon, good evening to everyone who is joining today, and welcome to today's webinar hosted by the Great Lakes Peace Center and the Coalition Against Hepatitis for People of African Origin, or CHIPO, and the Ubora Foundation of Africa and Ubora Women for Peace and Health Initiative. My name is Beatrice Dovich, and I am a Public Health Program Manager at the Hepatitis B Foundation and the Manager of CHIPO. Thank you all so much for tuning in today. Today's webinar will provide a brief overview of CHIPO, and then we'll showcase some of the excellent work that is being done around hepatitis elimination in Uganda with the involvement of many different community members and stakeholders. We will conclude all the presentations with a brief introduction to a very new idea about forming a loose consortium of different like-minded social justice organizations around Africa who can potentially join together to seek out and apply for funding opportunities for their collective goals. So just a quick note before we start about using Zoom webinars. So I would just like to remind all participants that during today's webinar, all audience members are muted. We encourage you to use the chat feature to let us know who you are and where you are joining from. And if you have any technical challenges, please indicate your issue using the chat box and we will address it as soon as possible. If at any time during the presentation you have questions, you can feel free to enter them into the Q&A box, and questions will be addressed by the speakers at the conclusion of the presentations. This session is also being recorded, and the slide presentations will be shared via email with all attendees and registrants. Next slide, please. Thank you so much. So we will now, I will provide a brief introduction to all the speakers who we are excited to have with us today. So first, I would like to introduce Arafat Bwambale, who is the co-founder of Great Lakes Peace Center, which is a grassroots youth-led organization advocating for the rights of those living with hepatitis and encouraging testing, vaccination, and linkage to care for people in rural communities in Uganda. He works with Great Lakes Peace Center and Ubora General Hospital Public Facility. He is a public health officer and a senior medical clinical officer who is actively engaged in social accountability, advocacy, and peacekeeping works to support youth empowerment and social justice in Uganda. He is the Ubora General Hospital focal person for hepatitis B in Kasese region. Great Lakes Peace Center is located in Rwenzori region and is very dedicated to breaking down harmful misconceptions about viral hepatitis among the general population. Arafat is also a member of the Hepatitis Technical Working Group at the Ministry of Health, a member of the Hepatitis Consortium in Uganda, and has worked on the National Strategic Plan to eliminate hepatitis. So we're very glad to have Arafat with us here today. Our second speaker is Elias Musime, who is a management systems specialist and team leader with over 7 years of experience of providing technical assistance to the establishment and implementation of quality management systems, leading to international accreditation and certification to ISO standards. Through his leadership at the Ubora Foundation Africa, he has supported the promotion and provision of quality, equitable, and accessible healthcare services to underserved rural communities and populations such as people with disabilities. He has led a number of community projects that have brought services such as health education, screening, and immunization for hepatitis B in Uganda. He has also supported capacity building projects for health workers in providing accurate, reliable, and timely hepatitis B services to the people of Uganda. Elias is a hepatitis B champion and dreams of a world free of viral hepatitis. And our final speaker, who will be joining us a little later, is Sylvia Kabugo, who represents Ubora Women for Peace and Health Initiative. And she will be sharing about the involvement of women in linkage to care efforts and the integration of community health workers into hepatitis elimination work. So we are thrilled to have all of our speakers with us today. I will actually begin with a brief presentation that provides an overview of CHIPO and the importance of awareness raising and coalition building in general. Next slide, please. Thank you so much. So CHIPO, which again stands for the Coalition Against Hepatitis for People with African Origin, is a national, in the United States, community coalition that was co-founded in 2013 and led by the Hepatitis B Foundation. We are comprised of individuals and organizations who are interested in addressing the high rates of hepatitis B infection among African communities in the US. And CHIPO serves as a forum for sharing information and best practices and trying to improve overall national capacity to improve hepatitis B awareness, testing, vaccination, and linkage to care among highly impacted African communities. And CHIPO works to bring together people from around the country who are working in their own local communities to address these very issues. And so far, our work has been primarily focused among African immigrant communities in the United States, but we've recently expanded to trying to support efforts in Africa just over the past few months. So this is very new, but we are trying to expand our reach as much as we can. We are an unfunded coalition, and the foundation has few unrestricted financial resources. The majority of our funding comes from grants and donations, but we do try to support efforts where we can, and we are looking into ways that we can increase levels of support and form new partnerships in the future. Next slide, please. Thank you. So just a quick overview of some of CHIPO's activities and achievements. So one of our primary focuses is to share relevant topics, research, and interventions through delivering presentations, bi-monthly coalition calls, and webinars. We also work to promote stories and storytelling about the experiences of living with hepatitis B through our Just B storytelling program. And we have recently collected stories from a few different African community members, which I will share in the chat. And this will also be shared as follow-up from the presentations and webinar as well. But you can feel free to check out any of those stories from our 5 storytellers. And we find this to be an effective strategy for reducing stigma and just getting hepatitis B to be talked about more. We also engage in advocacy efforts, such as the initiative to gain federal recognition of National African Immigrant and Refugee HIV and Hepatitis Day, or NIRA Day, which has recently been placed before the Department of Health and Human Services in the United States to try to gain this recognition of this day as a federal health observance, which would go a long way towards raising awareness and providing culturally appropriate resources to address these health concerns in African communities. So I've put the NIRA Day website in the chat as well, if you would like to learn more about that. We also conduct research and write publications, including a recent one that was published in 2020 entitled Barriers to Hepatitis B Screening and Prevention for African Immigrant Communities in the United States, qualitative study. And I will put that link in the chat as well, so you can check it out. And finally, we work to provide educational resources that are culturally and linguistically relevant that can help to increase levels of hepatitis B awareness, screening, prevention, and linkage to care. And most recently, this was done in partnership with the Centers for Disease Control and Prevention's No Hepatitis B campaign. And it includes PowerPoint presentations, flip charts, and takeaway cards, all of which have been translated into French, Swahili, Arabic, and Amharic. And these are available for download on our website and can also be requested to be sent to you. So I put that in the chat as well, so you can take a look. And next slide, please. Thank you. So that is all I have for today for a quick overview of CHIPO. You can feel free to visit our website for more information, to check out more of our programming and what we do. I will put that in the chat, and you can also reach out to me via email if you have questions or would like to learn more. So thank you so much for your time and attention today. And for audience members, if you have any questions about CHIPO, feel free to put them in the Q&A box, and I will do my best to answer them at the end of the webinar. And we would now like to transition to highlighting some of the work of Great Lakes Peace Center. So to begin, we will play a brief video. And then I will pass it over to Arafat to begin his presentation to further explore the work of Great Lakes Peace Center with particular emphasis on the role of young people in viral hepatitis elimination. So Fiona, if you wouldn't mind sharing the video, thank you so much.
Restrictions on the use of motorcycles as a means of transport has had far-reaching impacts on many lives, especially the low-income earners. In Kasese district, in Bukonzo West constituency, many of the low-income earners with chronic diseases were left with no option.
Bodaboda hazina namna kutubeba, basi inakuwa ugumu kwetu kuweza kufika hospitali.
Wetabetsebu ahawere burango kutukagenda awesya bodaboda sisi kinani sisi kiheka bandu busana n'oburwere obwesire obwe COVID.
But all hope was not lost for them. There was a health worker who considered his job a calling. Arafat Bwambale has labored to deliver medical supplies to patients who have no access to health facilities.
We work with the committee of the elders who are living with the hypertension and the diabetes, and they go ahead and profile for us those particular elders and people living with hepatitis, those we can be able to support. It is through their coordinator that me as a person who was born in Bwera, particularly in Bukonjo West, we are able to come and fill that gap.
Arafat says he sometimes has to walk in order to deliver the drugs.
And the logistics, of course, how do you travel without fuel? I work with the Great Lakes Peace Center as their program director for health promotion and education, and through the support of Great Lakes, we are able to continue working, even when we have limited resources.
Despite his will to help the vulnerable groups get refills on time, the terrain remains a challenge.
Those who live in the mountainous areas, of course you can't go there with the bike. I walk on foot, particularly to help and fill the gap of those elderly people who desperately need the drugs for hypertension and diabetes.
But he does not regret his decision.
Most of them are my parents and are elders of this community. So I feel like they made a very big contribution towards my schooling, and immediately once I qualified as a medical health worker, I feel during this COVID-19 with my friends at Great Lakes Peace Center and the few volunteers I work with, it is important for us to be there when they also stood for us when we were still young.
Story filed by Fahad Masereka for NBS, Your Story.
Thank you so much, Arafat, for your amazing work as highlighted in the video. And I now invite you to begin your presentation. Although he may have dropped off. So perhaps, Elias, if you wouldn't mind sharing your presentation first, and then we can go back when Arafat is hopefully able to rejoin. So would it be okay to advance the slides to Elias's presentation? Thank you so much.
Thank you so much, Beatrice. Good afternoon, good evening, or good morning, wherever you could be watching this from. My name is Musime Elias. I work in Uganda at Ubora Foundation Africa. I'm the founder and team leader. I'm grateful for this opportunity that Chipo has provided to us and my partners, that is Great Lakes Peace Center, be able to share the work that we are doing in Uganda in the fight against hepatitis. Next slide, please. Okay, so just a little bit about hepatitis. We very well know that over 2 billion people are exposed to hepatitis B infection across the world. And approximately 1.5 million people become newly infected each year. So that means that the infection of hepatitis is highly growing at a very fast rate, and therefore we need a lot of effort to ensure that we can curb this rapid spread of the virus. And approximately 10% of the infected individuals are diagnosed. So that shows the gap that is there in trying to identify people in communities that have hepatitis. And an estimated 820,000 people die each year from hepatitis and other its related complications. So hepatitis really is a serious threat, public health threat, and we really need to double efforts to ensure that we can manage it. And in Uganda, where I come from, it's estimated that only 4.1% of the population between 15 to 64 years has this chronic infection of hepatitis. But I must say that this statistic is actually may not actually stand true today, because we know that many people become newly infected each and every day. So it might actually be more than 4.1 if we did a proper survey across the country. Next slide, please. So there is a map of Uganda, and it shows the prevalence of hepatitis and how it is distributed across the country. And as you can see, the mid-north area of the country has the highest prevalence at 4.6%. And the lowest is the southwest part of the country, which is at 0.8%. But what this actually shows you is that hepatitis is widely spread across the country. At least each region of the country has cases or has people that are infected with this virus. And according to, okay, so I just wanted to say that Ministry of Health reports that only 9 out of 10 people, 9 out of 10 people do not know their status of hepatitis. So this shows that a lot of people are out there and they do not know whether they have this virus or not. And our Uganda Cancer Institute reports that 80% of the liver cancers reported each year are due to hepatitis B. So it means that hepatitis is actually causing serious health problems in our country. And a lot of effort is actually needed to be able to bring this down. Next slide, please. So what the government of Uganda is doing to eliminate hepatitis or reduce the spread of hepatitis, they have done a little bit of training of health workers to be able to identify or diagnose people and properly manage those who are found to be positive for hepatitis. They have also developed and distributed guidelines in management of hepatitis. They have also provided resources that are needed for testing in most of the government facilities, and vaccines for immunization and drugs for treatment. And they have also done some campaigns, community campaigns, to try and immunize people against this hepatitis. And they have also done some bit of education for the people to be aware about this virus and to protect themselves from contracting the virus. However, the coverage of all these services is still quite low across the country. And that's why, as civil society organizations, Ubora Foundation Africa, Great Lakes Peace Center, and other partners that are supporting hepatitis are coming in to try and scale up what the government is doing. Next slide, please. So as Ubora Foundation Africa, we are at the forefront of the fight against hepatitis, and we've done a lot of community education in partnership with other organizations like Great Lakes Peace Center. We've done capacity building for health workers to be able to diagnose hepatitis, for example, and ensure that quality results are provided, to be able to administer vaccines safely, and also to be able to prescribe treatment for people who are positive for hepatitis and follow them up for completion of treatment. We've also done increasing access to the services like testing and immunization, where we do community outreaches and conduct testing and also immunization to people in rural communities. Because in our country, health facilities are usually very far from the homesteads of people, and therefore people have to trek long distances or cough a lot of money to be able to access healthcare facilities. And that's why it is important that we bring these services closer to them through community outreaches. As Ubora Foundation Africa, we've also supported infection prevention and control in health facilities through training and also providing resources that are needed to ensure that health facilities are clean and well disinfected, and there is no waste that is littering around communities and within the health facilities that can actually predispose the people who visit facilities to hepatitis. And that we have done and we still continuing to do. We've also strengthened quality assurance in health facilities through training of healthcare workers and providing SOPs that are needed for health workers to provide hepatitis services and these services to be of quality. Next slide. And as health workers in our country, they are really doing a lot of work to be able to contribute to the fight against hepatitis. And in Uganda, we have mainly two categories of health workers. We have the mainstream health workers that are qualified and are working in healthcare facilities. And we also have community health workers who also do a lot of work. They have been empowered to mobilize people. They've been empowered to follow up people, to do contact tracing, and to link people from communities to healthcare facilities. So part of the work that all these health workers put together are doing, they are doing a lot of education and providing awareness about hepatitis. And as Ubora Foundation Africa and Great Lakes Peace Center, we empower them to be able to do this work within the healthcare facilities themselves, but also outside the healthcare facilities through community outreaches, where we hold community sensitization meetings and we take health workers or community health workers, and they are able to train people and educate them about hepatitis. Health workers are also doing a lot of testing within the healthcare facilities themselves, but also in the community. However, we've not gone ahead to empower community health workers to do this training, partly also because of the limited resources, because you have to be able to provide testing materials to community health workers to be able to do this job. But we believe that it is something that is needed for us to empower community health workers to be able to also conduct some bit of screening in the communities. But a lot of work is actually being done to test people for hepatitis. Health workers are also doing a lot of referral of specimens for hepatitis B viral load because part of the Ministry of Health guidelines is that all people that are tested positive are supposed to be tested for hepatitis B viral load. And we have only one facility, one laboratory, national reference laboratory in the country that is able to perform this viral load. So what is needed is for the health workers at the different healthcare facilities to be able to collect samples, package them well, and transport them safely to the national reference lab for viral load testing, and also be able to receive results from the reference lab and ensure that they are well managed and disseminated to the patients, but also used effectively to manage these patients. So they are doing a lot of that. They are also linking patients for treatment within the healthcare facilities and from the community. And also immunization that is done within the healthcare facilities and also in the community. And health workers are really doing a commendable job to be able to reach all people that are negative with vaccines. And a lot of contact tracing is also done in the community so that all people who test positive but have been exposed or have exposed other people like their partners can also be identified and screened for hepatitis. Though, like I mentioned earlier, all these efforts that are being done need to be strengthened, and they also need to be scaled up to reach all the people within the country. Next slide, please. The challenges that are there right now in the country in the fight against hepatitis. We have a number of challenges, but just to highlight 3 of them, is that we have still limited number of civil society organizations supporting hepatitis in the country. If I'm not mistaken, there may not even be more than 5 CSOs that are dedicated in the fight against hepatitis. And we gone ahead to urge different CSOs and different NGOs in the country to be able to support this infection so that we can completely eradicate it in our country. And the second challenge is that we have inadequate opportunities for funding to CSOs that are supporting hepatitis. For example, Ubora Foundation Africa, we've done all the work that we have done in the fight against hepatitis with minimal funding. And it is a challenge because we are not able to put these services to everybody that needs them. And the challenges that Ubora Foundation of Africa is facing in terms of funding are the same challenges that Red Lakes Peace Center is facing and all the other partners. So if we can have more opportunities to obtain funding so that we can actually ensure that testing is scaled up, immunization is scaled up, and treatment is scaled up, as well as education and awareness. The last challenge that I want to highlight is the lack of regional and continental partnerships in CSOs supporting hepatitis. And I'm grateful for Chipo for bringing us together as CSO supporting hepatitis in Uganda, but also across Africa and the world all over, so that we can merge efforts, so that we can all come together and share ideas and share opportunities and be able to scale up the work that we are doing in our different countries, but also strengthen the work that we are doing. So my call to action is that we can establish regional and continental civil society organization partnerships that are focused on hepatitis, through which we can actually share knowledge and experience and share opportunities and resources if need be, to be able to completely put hepatitis to a stop in Uganda and all the other countries across the world. Next slide, please. So this brings me to the end of my presentation. And I just want to end by saying that people with great passion can make the impossible happen. Like I highlighted earlier, we might be having challenges, but because we are passionate about healthcare and are passionate about eradicating hepatitis, we believe that our passion will enable us to stay on course and enable us to be able to push and eliminate hepatitis all over across the world. Thank you so much, and you can reach out to us on our website. Our website is Ubora Foundation Africa. Just have to Google that on all social media platforms. We are there. You can reach out to us, and we can be able to share with you more, and also get in touch with other organizations out there. Thank you so much, Beatrice, and over to you.
Thank you so much, Elias, for the wonderful presentation and the great summary of the work that Ubora Foundation is doing with community health workers and health systems to improve efforts towards hepatitis elimination. We really appreciate your work and highlighting the gaps and challenges that remain as well. If a reminder, if anyone has questions for Elias, please put them in the Q&A box. I apologize that the chat function seems to be disabled. I'm sorry about that, but if you'd like to introduce yourself and where you're from, you can do that using the Q&A box temporarily as well. So apologies for the malfunction. But we appreciate Elias's presentation so much, and we will now transfer over to Arafat, whose video we saw previously. But we can now pass it over to begin his presentation and talk about in more detail the great work that GLPC has been doing around hepatitis elimination. So Arafat, I will pass it over to you. Thank you.
Yes, thank you very much, friends. Good morning from Uganda, across the world. Good afternoon and good evening from Uganda. Let me say how glad I am to just showcase what we have been able to unlocking hepatitis elimination in Africa continent. Next slide, please. Next slide, please. Great Lakes Peace Center, our vision is to envision where young people, women and men are civically empowered and productive to ensure that our societies are much more healthier and the involvement of young people is put on table. And then at Great Lakes Peace Center, we are empowering, mentoring and transforming families and communities to be responsible over their own health and to be able to make sure that we have our everlasting peace. Like we have already said most times, that there's peace is not mere absence of war, but rather social justice. So in terms of social justice, we must have a society that is very productive. Next slide, please. About Great Lakes, we started it in 2015, just inspiring young people. We are located in Kasese, Western Uganda. We have ambassadors, peace ambassadors, and like you saw in our video, during the pandemic, when we had a breakdown in the public system, we had restrictions, we were able to rally about 5 volunteers who were able to walk on foot, ride the bicycles and motorcycles to go to the mountains and make sure that we deliver the medicine or the services that are urgently required. Next slide, please. We support HIV, hepatitis affected families and orphans, vulnerable children by just providing comprehensive information about the prevention and care and management within our region. And we do a lot of advocacy, including the young people into the mix, just promoting good health and well-being, and fighting gender-based violence in our communities as social evils. And then also we foster international understanding about peace in our region. And as you know, that Great Lakes is a region that is having a lot of recycling of conflicts. Next slide, please. We at Great Lakes, we have been at the policy level by advocating for social issues in our region. Like at the national level, recently we were able to meet our parliamentary health committee to interface with them to ensure that we have a policy shift, introduction of bus doors, and also importantly, like my colleague Elias talked about, the resource envelope to make sure that we are able to resource mobilize. And we're happy we were received by the parliamentary health committee. We definitely have been engaging with other civil society organizations, the government, and we are very happy to government was able to allocate $1 million to ensure that we are able to have the expanded program for immunization to ensure that people have access to vaccination. And also notably, we at Great Lakes Peace Center, we are part of we are members of the Coalition for Global Hepatitis Elimination, World Hepatitis Alliance, and then also Coalition Against Hepatitis for People of African Origin. But also importantly, we work as technical group at the Ministry of Health in Uganda. And also we are part of the consortium that we are building in Uganda to deal with the hepatitis elimination. Next slide, please. Our works and success. Since we started, we have been able to mobilize about 300 youth among the African countries and beyond to be able to ensure they attend our Rwenzori Youth for Peace. Like I alluded to the fact that peace is not mere absence of war, but also communities need to be healthier. So throughout these Rwenzori Youth for Peace platforms, we are able to also to highlight, to give some spotlight on social issues that affect people living with hepatitis, stigma and discrimination. One of the things that we continue to grapple with in Uganda is that people living with hepatitis are stigmatized and discriminated. But also under the Rwenzori Youth for Peace, we also highlight the awareness rising about hepatitis, sexual reproductive health that affect young people and women. But also importantly, one of our works is that we have been able to continue involving ourselves in the No Hep campaign, Mama. This campaign in our Great Lakes region in Uganda and particularly in our region, we continue to have outside birth. And if we are to get to the elimination, then we must be able to do the triple investigation of HIV, syphilis, and hepatitis B, but also importantly to encourage pregnant mothers to attend antenatal. And this is the effort which we have been trying to reach out to the Rotary Snow Peaks of Kasese and Winchester, and have been supporting our works and the success to ensure that mothers attend antenatal care. Next slide, please. But also importantly, recently for 1 year, we are going to be raising awareness in the local languages. I just want to quote verbatimly. The president of South Africa quoted and said, when you're speaking to someone's foreign language, you're speaking to their heads. But if you speak to someone's in the local language, you're speaking to their hearts. So we have a program and a campaign where we disseminate information in our local languages, especially we speak Lukonzo, Lutoro, Luganda, to ensure that the messages of prevention, vaccination, care and management among the general population at the grassroots to avoid the myth and misconception. And we are very glad to Chipo that has been supporting this effort. But also importantly, other works which we have been doing the introduction of hepatitis B birth dose introduction with the support from the Coalition of Global Hepatitis Elimination to ensure that health workers are trained, but also importantly, the pregnant mothers who are attending antenatal care, to give them the justification to why they should be able to be vaccinated within the 24 hours to prevent the mother-to-child transmission, but also the healthy workers, how do they offer the services to the people or the clients who come to the health facilities. Next slide, please. But also importantly, among our successes, last year, 2018 in Bonn, we were awarded the finalists as the UN National SDG Action Award, just because we are able to translate all the SDGs into our local language to ensure that, because the SDGs are the blueprint which we are following and trying to make the communities healthier and prescribing solutions. So among our successes, we are awarded as being the finalist by the UN Nation SDG Action Award in Bonn for translating SDGs in the local language. Also importantly, like Adaria talked about, that our interaction with the Parliamentary Health Committee, and this definitely is just to cause policy shift and also to mobilize resources, because even when we continue to raise awareness, we can't bury our heads in the sand. We definitely need the resources. And locally, the local funding is very critical, and also key players like the Parliament of Uganda is very critical, and African parliaments are very critical in terms of making sure that we are able to eliminate viral hepatitis. But also the other thing is that things to deal with stigma and discrimination need to be addressed at the National Assembly or the parliaments, where people can cause policy shift, because some people are denied to join the labor markets because they're living viral hepatitis, and we want to break this barrier. The other important thing is that we are part of the Technical Working Committee of Ministry of Health, and recently, among our successes, we are able to draft the National Strategic Plan, and we are sure that this guiding tool will be able to help the country of Uganda and other continents for purposes of comparison and benchmarking, to ensure that on the mother continent, we are able to eliminate viral hepatitis in our continent. Next slide, please. Like I'd already alluded to the fact that these are some of our works and successes. This is when we are going for our award, and we are given the award for being the SDG award finalists for translating the SDGs into our local languages. Next slide, please. This is one of our works and successes and the campaigns which we carry out, raising awareness about SDGs among school girls, but putting focus on HIV and hepatitis among the adolescents or young girls in the rural communities. Next slide, please. So what we are looking at is that those are a couple of times when I'll be working with my colleague, Masereka, and other volunteers to see how we set off for the medicines that were prepared. And definitely this was during the COVID-19. The first photo demonstrates when we had just reached to deliver the medicine to the uphill places, but also the next photo demonstrates how we are preparing to ensure that as volunteers, we go and deliver the medicine to the people who needed them most, and also those who are disproportionately affected by viral hepatitis. And more importantly, we would work through telephone conversation, through their committees of people living viral hepatitis, would reach out to them. They give us to those people who are mostly needed, and then we are able to reach them through the LOC system and call them by phone to ensure we deliver the medicines. Next slide, please. Oh yes, this is one of the campaigns which we are doing, especially when we are talking about the importance of the hepatitis B vaccine for the children within 24 hours. Myself, I was demonstrating to the women in our local language how prudent it is for us to have the vaccines, and once they deliver, to have the vaccine, because one, it helps to prevent the liver cancer, but also to prevent the transmission of viral hepatitis B. So once we introduce this first dose, then definitely we are able to work out the prevention on mother continent. And these were just mothers attending antenatal care. This is my colleague Pinky, who had come in to support the efforts of the campaigns to ensure that our message sinks deep to the mothers who are attending antenatal care. And this support came in handy from the coalition the coalition of global hepatitis elimination. Next slide, please. Yes, this is one of the activities which we do as Great Lakes Peace Center. We have just been called upon or to extend our outreaches on the campsites. People are constructing a dam and a facility, and definitely wouldn't sit back, but to go to be at the site workers to ensure we also disseminate information about viral hepatitis. We involved ourselves in screening the site workers, but also importantly, carrying out health education, but also to ensure that we prevent the transmission of viral hepatitis. These are some of the activities we are doing. Next slide, please. Yes, there we were doing community baraza localizing help information in a local language. And this is the campaign which courtesy of Chipo, they have been supporting us. We're able to develop materials in our local language, translating them in Kiswahili and Lukonzo. And those people who are seated on the ground, which was myself and my other colleagues, whom were carrying out our outreach, but also importantly, it's a group of the village health teams that we are sharing our information, because the village health teams are the first people who interact with patients to ensure that they do contact tracing, but also link them to care at the health facilities that work with, which we have already profiled as Great Lakes Peace Center. And all this work is being supported by Chipo. Next slide, please. I just want to say, Mwasinja Kuthibu, thank you very much for listening in. But just before I wrap up, it's very critical that to share with you that 9 out of 10 mothers or pregnant women who attend antenatal care do not know their status. So we believe that Great Lakes Peace Center, to ensure that it shares information among the general population, to ensure that they attend antenatal care, is very critical. And the other important thing in Uganda, in the general population, 9 out of 10 people do not know also their status. And we are sure that about sharing our information, education, and communication really will help us to get to the end by 2030 to ensure that we have a generation-free society. Indeed, there's no way to peace. Peace is the way, is the inclusion of young people. And if you are to eliminate, viral hepatitis on mother continent, the young people must be able to be part of the policy shift and engagement of all activities that will eliminate viral hepatitis. I thank you. Mwasinja Kuthibu.
Thank you so much, Erica. That was a wonderful presentation, and we really appreciate you highlighting the great work that GLPC is doing in such a rich and insightful way. So just a reminder, if you have any questions, please put them in the Q&A box. I see that there are some questions in there, which is great. Before we get to them, I just want to ask Arafat, do you know if Sylvia will be joining us to speak? Oh, yes, excellent. Hi, Sylvia. So I will now invite you, Sylvia, who's joining us from Ubora Women for Peace and Health Initiative, to share a little bit about the involvement of women in linkage to care efforts and the integration of community health workers into hepatitis elimination efforts. And then we will start taking some questions. So Sylvia, I will pass it to you. Thank you so much.
Thank you so much. My name is Ubora Joyner from Nyamamkawan village, a member of Ubora Women for Peace and Health Initiative. First of all, I do thank you so much for making us part of this discussion. We as members of Ubora Women for Peace and Health Initiative, we have looked for ways to eliminate the spread of hepatitis B in our community. First of all is patient education. Here we educate the patients about the preventatives of hepatitis B, and we encourage them to take their partners and family members to the hospital so that they can be tested and know where they do belong. This has helped us to eliminate it in our community. And another thing is, whenever people are having hepatitis B, they do get a lot of stress, social stigma comes in, end up leading to mental health problems and sometimes death. So what we do, we as members of Ubora Women for Peace and Health Initiative, we go to the hospital and pick drugs for these people. And this has led them to gain some comfort, eliminating it in our community. And another thing is training. Whenever we hear that there is a medical camp at the hospital, we do inform the public about what's going on there, and people go there and and get screened. Those who find out that are positive, they start the dose. Those that are not having hepatitis B, they get vaccinated. Thank you so much. That's what I had for you. God bless you.
Wonderful. Thank you so much for sharing about the wonderful work, and especially about how you're integrating hepatitis into larger medical camps and making it part of the larger conversation. So before we move on to the end, we have a couple of questions in the chat. So I will just read them out, two of them that came in. So the first one is, Uganda government has made plans to introduce the hepatitis B birth dose in Uganda, which is very commendable. Since you are working in communities, what is your assessment of the likelihood of pregnant women in having their newborns vaccinated against hepatitis B within 24 hours of birth? So we'll start with that question. So do either of you, Elias or Arafat, have thoughts on how to increase uptake of vaccination now that the government has introduced birth dose?
So I think I can take that. So yes, as rightly said, Minister of Health has approved the hepatitis B birth dose, and we are grateful for the Minister of Health for that great stride. And what we've been doing, and together with Great Lakes Peace Center and Ubora Foundation Africa, has been trying to now educate the mothers, the pregnant mothers who attend antenatal care, to inform them about this initiative that is coming, and trying to inform them that the dose that we recommend for the children, for the newborn children, is actually safe. And the feedback that we are getting, of course, there are a few people who are skeptical about the vaccine, just like any other newly introduced vaccine. But I believe that with continued education and behavior change, I believe that they'll be able to understand and comply once the vaccination is rolled out. But I must say that the feedback is not so bad. We just have to ensure that we reach every person and inform them about this, so that once the vaccine is introduced in the healthcare facilities, it is adequately taken up.
Wonderful. So education at the community level is very crucial. Arafat, did you want to add anything to that about increasing implementation of an uptake of Hep B birth dose now that the government has endorsed it? And Elias was speaking about increasing education for mothers as being a primary method?
Yes, thank you very much, and thank you, the one who has asked that question. Yes, already government is in its really very commendable stages to ensure that the hepatitis birth dose is introduced. What we are doing as civil society organization with support from the Coalition of Global Hepatitis Elimination is to ensure now to prepare the pregnant mothers and the grassroots communities to tell them about the importance of the vaccine, that it prevents viral hepatitis B from the transmission of mother to child transmission, but also importantly, it prevents the cancer, the cancer of the liver. And of course, this definitely makes them aware that it's important to have the vaccine. The other important thing is that the government of Uganda had already allocated about $1 million to expanded program for immunization to ensure that viral hepatitis is cascaded or it's being delivered to all health facilities free of charge. And we want to thank so much the government of Uganda for that effort. Since they're the ones who gave us some money, we also have already gone back again to Parliament and those shades of opinion to ensure that they allocate more money to this effort. But otherwise, as CSOs, we are preparing the general population to know about the importance so that once it is delivered, then they are able to take it up. The other issue which I have seen, someone has just asked about the home deliveries. It's not common in Uganda, especially in the grassroots areas where the biggest population stays. It's not there. We did the home deliveries ourselves during the pandemic because the president had, and through the Public Health Act, they had put restrictions on transport. And as young people, we just felt it's very important for us to use our energies in terms of walking, riding the bicycles, and also riding the motorcycles to ensure that we deliver the medicine to the people who desperately need it. Then also I've seen another question about the selection of the languages. One, we prioritize Lukonzo because it's within our region where we work, in the Rwenzori region, but also moving forward, we think once the resource envelope allows us, we shall be able to add on these other languages because we target the Nyakitara, Nyankole, Luganda, Lugbar, and all these languages. Because Uganda is heterogeneous, but this is just something to showcase that if you want to sync the information, other African countries or in other places, you can be able also to translate into your languages. But because the African continent is heterogeneous, we have very many languages that are spoken there. But what is critical is to put into the information, education, and communication into the local dialect so that it syncs to the grassroots women and young people. Thank you very much.
Wonderful. Thank you so much, Arafat. And then we have one more question as well. Is the Uganda government doing anything to ensure more than one center for Hep B viral load testing, which I think Elias had mentioned. Do you want to take that question?
Yes, thank you so much, because I'm the person who asked for that question. Like I said, currently we only have one national reference laboratory that is conducting hepatitis B viral load testing. And I must say that efforts have really been made to improve the laboratory structure in the country and provide capacity for even lower laboratories to be able to do hepatitis B viral load testing. We can see that this has already been done for other diseases like HIV/AIDS, where we have point of care viral load testing now being conducted in lower facilities at regional referral level and other facilities. So we believe that the facilities have the capacity to do this testing. It's just now the aspect of logistics, which is a challenge. But as civil society organizations, we are engaging Ministry of Health to ensure that point of care testing for viral load hepatitis B is also provided at lower facilities. And we believe going forward, this shall actually become a reality.
Excellent. That's very encouraging to hear. So I'm glad it's slowly moving forward. So it seems we have just one more question, and then we'll move to our next, the final part of our slide. So this question is from Prince in Nigeria, who represents Hepatitis B Advocacy Initiative, and would like to know from Arafat about what strategies that you consider might have helped the Great Lakes Peace Center to record great successes that you can recommend to deploy in Nigeria to get the government to show more interest in the fight against hepatitis B? I think this can be for both of you as well, if you have any insights into how the government can become more engaged.
Yes, I can start before Arafat comes in. So for us, really, the only strategy that I can say has really worked has been a continuous engagement. We have engaged all sorts of levels. At Ministry of Health, we have engaged all the authorities there. And like Arafat said, we have also engaged other authorities like Parliament. We have already reached out to the Parliamentary Committee for Health, and we have interested them, and I informed them about hepatitis B and what as the Parliament can actually do to contribute to the fight against hepatitis, viral hepatitis. So for me, it has only been about continuous engagement. And I must say the other thing has also been collaboration, because as civil society organizations dealing in hepatitis, we are trying to not work in silos, but actually work as a team, as a group. And we do all these engagements as a team. So I believe that, collaboration and continuous engagement are the only other ones that I can actually highlight right now as the ones that have led to the successes that we have seen across the country. But Arafat may add on something.
Yes, thank you very much indeed. Taking the path of viral hepatitis elimination is not for faint-hearted people. We have been in the trenches for some time, but definitely trying to amplify and raise the profile of viral hepatitis infection in the country. Like my colleague has said, is that, we have to raise the horse by its horns to ensure that we cause accountability to the leaders, but also using the social infrastructure which we have, like trying to reach out to Parliament, like my colleague Elias had already alluded to the fact, but also going to the grassroots, like the local administration, also the politicians, the cultural leaders, and the religious leaders. And then also harnessing dividends of young people. Like primarily Great Lakes Peace Center is a young people's movement, and like we partner with a lot of people who can bring a lot of energies in our movement, and also not working in silos like my colleague has said, but also reaching out to people to ensure that this is done. What is interesting is that we organize the charitable work. I think I want to appreciate the efforts of other civil society organizations, like the Organization of People Living with Viral Hepatitis in Uganda. We had a charitable work with the Prime Minister of Uganda, who was kind and also was able to work with us in the streets of Kampala to ensure that additional money is put there. But also the Ministry of Health, it is trying to do all it can to ensure that health services are delivered in line with viral hepatitis prevention. But definitely, like I said, the work is still too much, but we need to walk that path, which is which has ups and downs, but it's importantly to utilize the dividends of the young people. Indeed, there's no way to elimination. Elimination is the way with the inclusion of the young people. Thank you.
Absolutely. Well, thank you so much to everyone for your wonderful presentations. We really appreciate it, and thank you to such an engaging audience. So I'm sorry, I know we still have a few more questions, but just in interest of time, we want to wrap up. So I did just want to conclude the presentation today, just saying that it's been emphasized so much about how important collaboration is and not working in silos, and the importance of kind of banding together to combat this very important issue, this very pressing issue that just does not get much attention, or the attention that it deserves. So we know that many of you in the audience represent similar like-minded organizations around Africa. And with that in mind, we are beginning to work toward forming a consortium of sorts of organizations around Africa that can work together to seek out and apply for funding opportunities for viral hepatitis elimination projects, since we know, lack of funding continues to pervade most of these spaces. So there's a lack of financial and also human resources and capacity that often hinder efforts to addressing the low rates of hepatitis awareness, education, screening, vaccination, and linkage to care. And this is the case for CHIPO as well. So that's why joining together can have a really great power, as we have seen through the presentations today. So this idea is very new and it's not fully formed, but we're hoping to work together to bring it into fruition. And so if you're interested in exploring it further and in helping to be part of it and to contribute to the search and application for funding to further some of these great initiatives, we ask that you reach out to Arafat to get the discussion started. You can also reach out to me as well, but I put both of Arafat's email addresses in the chat, so you can feel free to reach out, and it will also be shared in a follow-up email following the webinar. So thank you so much again to everyone for joining today. And Fiona, if you could move to the last slide, please. Thank you. We really, really appreciate all of our speakers and all of the tremendous audience for your great questions, insights, and engagement. We hope that you found this webinar informative and valuable to your work or your life, and that you can apply some of the information moving forward, and that you consider reaching out to join together and find out how we can work more as a collective to address this important issue. If you had a question that did not get answered, you can feel free to reach out to Arafat or myself using the email addresses on the slide. Again, they'll also be shared following the presentation, and a recording of this webinar and the slide presentations will also be emailed out to all attendees, as will all the links and the websites that were mentioned. So please feel free to reach out and get in touch, and to visit any of our websites for more information. And we thank you all so much again for joining today, and wish you a happy rest of the day. So thank you so much. Take care.
Thank you.
Bye.